Scott and Sharon Gedeke strongly feel that they have so many reasons to be thankful. Their daughters are dear to them. They have a life filled with family, love, happiness, and they even find ways to be grateful when facing serious health problems.
When we learned about the diagnosis, it's incredibly frightening. It made us even tighter and more appreciative of the relationship that we have, the five of us.
His diagnosis is a rare and complicated disease. We are incredibly grateful to have Siteman and WashU and BJC the whole time, and it has been a blessing for him.
Scott has melanoma. It's an aggressive skin cancer that spreads to other parts of the body, and Scott's cancer is a rare type of melanoma.
It is not what many people think about on the skin. It's, mine happened to be, in my mouth, on the roof of my mouth. A particular diagnosis is rare and has been historically quite aggressive. Technology and the medicine really has advanced so much, even in a short period of time, even since I had my diagnosis. And I'm quite certain that if all that advancement hadn't happened in the last 10 years, I may have had the same outcome as what's in the literature about my condition, which is, median 9 months survival.
But now outcomes look a whole lot different. It's been nearly 4 years since Scott's diagnosis, and this man is in his corner, giving Scott confidence and hope.
Very reassuring and had a real confidence about his thought process.
Dr. George Ansstas. He's a Washington University physician and researcher at Siteman Cancer Center, based at Barnes Jewish Hospital and Washington University School of Medicine in St. Louis.
So Mr. Gadegi, actually, he's a patient of mine with a type of melanoma, is the most aggressive and the rarest melanoma, called the mucosal melanoma. So that arises from the lining of the mouth or any part of your gastrointestinal tract.
Ansstas is an associate professor of medicine at Washington University, and he's the leader of the solid tumor TIL therapy program at Siteman.
Solid tumors.
TIL is tumor-infiltrating lymphocyte therapy. Siteman Cancer Center is one of the first centers nationwide to offer TIL therapy for melanoma. This cell-based immunotherapy targeting melanoma is approved under accelerated approval regulations. The FDA gave Washington University physicians at Siteman Cancer Center that green light to give TIL therapy to certain patients with metastatic melanoma.
I was one of the pilot patients to get TIL therapy at Siteman.
And we're able to get these patients enrolled in a clinical trial because we have not had any other option for these patients. So the treatment is being approved for patients who fail all standard of care treatment. So these patients have no other option, knowing that there might be still good hope about this therapy. So TIL, we know it does have about 30% chance to work on patients, while unfortunately the other 70% will not work. So what happened, your own immune system, especially the T cells, they do a killing effect. But sometimes they could be not fully energized, sometimes could be underpowered by number. There are only few ones, but they do part of the job, but they cannot kill the whole tumor. So TIL therapy actually came from that concept. So I would tell them, we need first to extract part of your tumor. We send that tumor to the company. The company will extract the residing T cells in the tumor. They just take them out. They populate them in a petri dish, and then we give it back to you in a piggyback, like blood transfusion, and see if these cells, when we empower them, they can do the job.
It's use your tumor to make your medicine. That's really like the bottom line.
On Scott's follow-up with Dr. Ansstas, something happened that became so memorable.
He couldn't help but smile as soon as he walked in the door. And it was such an intense moment, really, because you just don't know what to anticipate. And his first words were, your scans looked great, you're a responder.
This is why Scott says he wanted to tell his story, because there is hope.
I want people to really understand that things like clinical trials, things like trying unapproved medications for your condition, if there are no other choices, that's a positive thing, and that something good can come out of it.
We have a faith in God's plan. We value and prioritize time together, but we really value minutes together. They all matter.